public health really is critical in our lives. You have to be involved in the community. Your community has to be healthy for you as an individual to be healthy.
Public health prevents disease, improves society, improves economies, and makes you a much healthier, happy person.
When I was a physician seeing patients, I realized that a lot of the problems that I was seeing, even in the United States, even in New York City, really had to do with public health issues. And we could address the public health issues, I think we can prevent a lot of the things that I was seeing.
If everyone has access to health care and they get preventive services and they get their acute and chronic illnesses addressed, we will have healthier communities, more productive workforce, healthier children. We will create an environment that's vigorous and productive and supportive of humankind.
We all live in a common atmosphere. We bathe in a common sea. We are more and more eating on a common food supply.
With globalization of the food trade, globalization of the economy, something that happens in another part of the world, like China, directly affects us. And we know this from everyday examples.
We're trading internationally. We are traveling internationally. Our blood supply, in some senses, international. We have diseases that travel internationally.
I have seen extremely close calls with diseases like smallpox and Ebola that were hours away from landing in an American or European city and just by chance did not.
One day we were at the program and this pimp walked into the program and said, "I need so-and-so," and named this girl. And the program director said, "You can't take her out of the program. We have to have parental consent." And the program director called the mother, and the mother said, "Let her go. We need the money."
There was a woman who had a fistula. The fistula was repaired. By the time that was done, her husband had remarried. She had nowhere to go. So the hospital kept her. She swept the floors. After some years, she began to wash the instruments from the operating theatre. Then she began to help the surgeons and hold the instruments. Now this woman, who is illiterate, does fistula repairs, which are very, very challenging surgeries that most American gynecologists would not like to do. And I think that's a wonderful testimony to the spirit of people, to the intelligence of people, even though they're poor and illiterate, and to the courage of people, and to what you can do when you delegate skilled tasks to people that you're confident can do them, whether they have a lot of letters after their name, like I do, or whether they're like this wonderful woman who I'm privileged to know in Addis Ababa.
We've found 14 cases right here in the Bay Area of automotive mechanics who were in various stages of disability from the use of these products. And it turned out that these neurotoxic solvents had been introduced into California as an alternative for another one that the state was trying to phase out for environmental reasons, but appropriately so. And the more we looked at it, the more it became a lens into a very broken system of chemical management and chemicals policy in California and also in the US. And of course, the more we looked, the more we saw. And it was fairly soon after that that the California legislature commissioned us to study the problem of chemical management in the state and come up with a plan that would put the state on a trajectory of preventing chemically related diseases and pollution, and also motivating a whole new business sector in what is called green chemistry and the design of safer molecules and processes.
People listen when you talk about UC Berkeley School of Public Health. And in the adolescent healthcare arena, when everybody's talking about, oh, can we do more research, can we do whatever, I can talk about community-based interventions that we're doing that are national models based on what I learned and got validated at the School of Public Health.
If you look at the alumni of the school already, they've been directors of the Centers for Disease Control. They work in the World Health Organization. They head county and local health departments. They head not-for-profit organizations working on health and advocacy for prevention. They're all over the world and all over the United States and certainly all over California doing that.
Berkeley, I think, was designed to be able to question rules and to question received information that is conventional, to question convention and say, wait a minute, is this good science? We're looking for good science to benefit health.
One of my passions really is looking locally and really looking at the local East Bay community, particularly Richmond and Oakland, and trying to make a difference out here in the Bay Area. Going to UC Berkeley gave me the opportunity to stay connected to those communities as well as further my own professional development, which is something I was very interested in doing while I came back to school.
I came straight from undergrad. I came very idealistic, enthusiastic about this new experience. And I think I'm a bit more realistic now, but more because I've learned about the health issues, really learned about the problems that are going on. But at the same time, being realistic, it's made me really motivated to want to have some impact to improve some of those health issues that I've learned about. So in a good way, it's not bad to be less, idealistic about things. And I think being realistic sort of gets more things done in the long run.
Usually after class, I'll find myself talking with my other students for hours and say, so how did you do this, problem, or what are you doing in your research, or how was your summer in Uganda? And we're constantly trading stories, and I've gotten half of my ideas about what to do just from talking to other students, and I hope I've been able to do the same with them.
And I'm just continually impressed by the caliber of these students, by their commitment, by their intelligence, by their knowledge they already have, their command of languages, their diversity. I mean, they're just a wonderful group to be with, and they make me feel young.
They're the future of public health. They're going to be the leaders. They're going to be the ones who are going to address these huge challenges that we're facing in future generations.
We also need to have a healthier world out there instead of a less healthy world. We need to have a healthy environment instead of a less healthy environment. We need to be looking at the future in terms of security for their countries, for all countries. And that has a lot to do with whether people have satisfying lives and whether they have healthy lives and whether children are going to school. It's just part of to me, it's a responsibility.